We've got breaking news out of Farmington this noon. There are reports of an Ebola situation at the Uconn Medical Center. A patient was admitted last night who returned to the U.S. from Liberia in late April. That patient has symptoms similar to those of Ebola, so doctors cannot rule it out. News 8's Mark Davis is there live this midday with more. Mark.
Good afternoon, Keith. Good afternoon, everyone from the Uconn Medical Center here in Farmington, where they're about to conduct a news conference on this health issue. Dr. Paul Skolnick, who's chair of medicine here at Uconn Health, is about to answer questions about this. Here's what we know at this point. Last night, a patient was admitted here at John Dempsey headquarters, which, as you know, is part of the Uconn Medical Center. That's John Dempsey Hospital. Now, although other diagnoses were more likely, they tell us, the possibility of Ebola virus infection could not be completely ruled out because of the symptoms and because this person arrived from Liberia on April 30th. So therefore, the Uconn Medical Center and John Dempsey Hospital have activated the Ebola virus protocols, which we've reported to you over the past year, the isolation and the suits and all of that, for proper care of the patient, the public, and the staff. The patient now is in that isolation that we've shown you in the past here at John Dempsey Hospital, and they say he is in good condition at the current time. Once again, a patient was admitted to John Dempsey Hospital with a high fever, and he had arrived from Liberia on April 30th, so they have imposed the Ebola protocols that have actually been in place in all of the hospitals in the state of Connecticut since the Ebola crisis first started last year. Now, News 8 medical correspondent Jocelyn Maminta is inside, and we'll have more information for you coming up later on during this broadcast. Live at Uconn Medical Center in Farmington, Mark Davis, News 8.